world of insurance, no say ka premium ye sika ubetria busumi biara no to keep your insurance. It's as the case busumi bi se when chia, then they cancel your insurance policy. It's premium no amount busumi biara no was say oye de uchia. Now we talk about deductible. Deductible no the amount ubetria from who pocket mo. And sana insurance na start to say ochia. Enti osane for insurance when you say $200 deductible. That means that before say insurance no be start here no, it was say no out of your own pocket no, it was say uchia sa $200 no and sana insurance no start here. And then co-insurance no a percentage. Ebi a osha insurance policy mu a or say oko receive service we ya insurance e betua 80% of the cost, wo betua 20%. Enti core insurance na I say mo only insurance company no match there was a mutua. Normally no in standard insurances na 80-20%. Insurance betua 80% of the cost, and then you also pay 20% of the cost. And then there's another terminology of my friend co-payments. Co-payments now is a flat rate. There is so primary care doctor before so I was so charge $20. And no your friend the co-payments. And now say I so specialist be a co-payments a 50. So was so charge and sana doctor no. And then almost baby say out of pocket cost. Out of pocket cost here. The maximum amount of money a be free bottom akọ insurance in 1 year. Obu no more the insurance policy no or say your out of pocket cost $8,000 for the year, which means say including your deductible, including your co-payments, including your core insurance amount, I will be churning in. When you reach $8,000 now, this is an example. When you reach $8,000 now, insurance will be 100% of it. It's depending on your out of pocket cost. Once you reach it, any service will be here. After that, maximum out of pocket will be covered 100% by the insurance. And insurance will be on in network and out of network. In network, say it's when a doctor will come and a hospital will call or the pharmacy you are going to know a facility or more accepted or insurance, which we call in network. So in your facility or more accepting your insurance now, sometimes you can receive service from them, but because you're out of network, you will end up paying more than senka uko mobia or in network. So back to our topic, like I said, Medicare. What is Medicare and who is eligible? Medicare, like I said before, government health insurance omudema will be a wedding fee 65 and older. And that's a 65, you have to have certain disabilities and other conditions be in order to qualify you. So when you're under 65, so over qualify, you have to be declared disabled for 2 years. And sana what's me a qualify. And that's disease be a friend ALS, and that's another name for it, a Lou Gehrig's disease, and also over qualify even if you are under 65. And now say you're diagnosed with end-stage renal disease, we are under 65, you will qualify for Medicare. But by standard, this is already 65, and now say older, and sana what's me I qualify for Medicare. Now, so qualifier normally you best send a card. It says it looks just like this. It will have your name on it. It will have your Medicare number. It will list what Medicare you have qualified for, and I say you have signed up for. It will say Part A, Part B, and then it will have a data or state or coverage, on the card. So that card, you over hospital and alcohol pharmacy, we always call it, say, the red, white, and blue card. It is once you become eligible for Medicare now, this is the kind of insurance you will receive. Now, I want us to go over some of the parts of Medicare. There are many parts, but the major one you talk about is the most, Part A, Part B, Part C, and Part D. Now, Part A, what we call the hospital insurance. And then as a call hospital, or the beko. Say, you go to hospital, that is the part a bit to take care of your friend say, in-house services. And I say, or stay at the hospital, that is what will cover it. Now, Part B, so Part B, most of the time, it cover will preventative care, will vaccines in the pharmacy, will diabetic supplies, and that's a medical equipment, and that Part B, cover. And that's a who or doctor or primary care physician that is the Part B, and the back cover, and then we have Part C. Part C, and that most of the time your friend of Medicare Advantage plan. I will come to it because the whole a bit complicated, kakra. And then you have Part D. Part D, is what we call your drug coverage. So normally, it's a qualify, UD 65, that's a qualify for Medicare. Part A, is what we call premium free. And so why a Juma US for 10 years. The actual policy in here said if you have worked in the US for 10 quarters. So if you've worked in the US for, let me bring it to lay terms, so why a Juma US for 10 years, what you have Medicare taxes for 10 years, Part A, a be free amount. You will not pay anything. So we call it premium free Part A. So as long as it says waba krum ha, now I juma, now which you have Medicare taxes for at least a chakra 10 years, you will qualify for a free Part A. Now Part B, you can say over top Part B, but depending on your income will determine how much you will pay for your premium, which is the monthly charges. Your income will determine the amount ubechia. There is a standard fee, but so income falling below, they can adjust the fee, and then when your income is too high, they can also adjust the fee. It depends on the income or receive. Now, Part A and Part B, it's what we call the original Medicare. It is so Bibanos or say, oh, I just want original Medicare. That means they said they want Part A or Part B. And I said they are covered under Part A and Part B. Now, Part C, a Medicare Advantage. Medicare Advantage, normally, a private insurances, or most also a come up with, or more a Medicare coverage. Let me put it that way. Part A and Part B, a government there. But private companies, I see they feel like they can do better than what the government is doing. And so almost also a form of what we call Part C. It's also overlooked by the federal government in India. So it's also very legit. But Part C, they bundle Part A, Part B, Part D in it together. Now what? It's oversee Part C, a private companies, a alternative to original Medicare, and just Part A ni Part B untimi nkoto Part C, and as Part C untimi nkoto Part A ni Part B. I hope that makes sense. So it's either you have Part A and Part B, or you have Part C. And I say Part A ni Part B ubetimi to Part D, which is the drug coverage, edia come. Most of the time, Part C, which is the private company one, And no, most of the time it includes Part A, Part B, and Part D. Some of them does not include Part D. And it's a top Medicare Advantage. You have to be careful to make sure, say, it will Part D coverage. Say any Part D coverage, you will have to buy another Part D. So I'm going to repeat this again. Part A and Part B, is the original Medicare by the government. Government oversee, Part C, private companies, they feel like they can provide better coverage than what the government is providing. In Tomono, they have bundled Part A, Part B, and sometimes Part D together. And no more friend of Part C. It is a water Part C now. You can get Part A and Part B. And that's all Part A and Part B into Part C. I hope that is clear. If not, they do questions as well. I will clarify that. So Part A, which we call the hospital insurance, it cover your inpatient care in the hospitals. So that nursing home, skilled nursing home, and in a bit that hospice care, hospital and in cover. And I say if you need home health care, say was send nurses a bit fee, no more behavior and no any bit nurses no eka. Part B, which is the medical insurance, it covers services from doctors and other healthcare providers. Any outpatient care, to say primary care doctor, your cardiologist, your pulmonologist, no more. Those care, Part B, and the cover. Sometimes, some of the home health care, especially on more diabetic, or has some diabetic durable medical equipment in the Part B, and the cover. To say they are wheelchair workers, if you need hospital bed in your home, and the big eka. If you use any preventative service screenings, OKYERE mammogram screening, OKYERE vaccine, or yearly wellness visits, ninyina Part B, ena ebekoba. Part D, D stands for drug. So Part D, it covers your prescription medications. Now, to set the American before the Part C, which is the Medicare Advantage, they bundled all the plans together. And as some of them will also have extra benefits. They may have dental coverage, or they can offer you gym membership. And it's again, Part C, it's run by private companies. And because of that, they make it look lucrative. There's nothing wrong with it, but they make it look nice to you. And outside of what the government provides, because it's they want to offer extra benefits, like I said, dental coverage, gym membership, nutrition benefits, but there are also restrictions. Or more restrictions, they have specific facilities and doctors that was use. Some of services they may require something called prior authorization. Prior authorization, agent I will say, okay, or doctor say, let's say a drawaway insurance in between, like I said, I won't try this a drill first. Have you tried this one? What try we have my patients, okay, we're drawing. So there may be restrictions as to what they will pay for, and there will be some prior authorization loopholes. I will say, doctor, overcome and sana, what me are providing in neuro and as services be to you. Or more out of pocket costs, sometimes, it was stroke kakra. And there's something called Medicare, which is supplemental Medicare insurance. And a bit complicated. I won't go much into it today. But if you have Part C now, supplemental insurance, and like I said before, more out of pocket costs, a dozen. So compare the original Medicare now, which is Part A and B, government, it provided, which is the original Medicare, and we'll compare with Medicare Advantage now. You can see, there may be a bit of restriction with Advantage Part C plan, more than with the original Medicare, So signing up for Medicare, say, you'll be already will receive social security benefits because of maybe some disability be and also some situation there. That's a undi 65. The first day of the month over turning 65 no, you qualify to be on Medicare. Say, and I know say none of us work with the railroad board, retirement board. So it only railroad for a year juma omono wouldn't di aka obeye 1 month I'm already 65 no, automatically abino ebe sendo o card. So automatically no udi 65 if you work for railroad retirement board and that's a receive social security benefits starting the first day of the month over turning 65 no, you will receive a card in the mail. And no, you don't have to go and sign up anywhere. Abinankasa automatically will send you your card. And that's so we are under 65. Now with disability. And like I said, you have been receiving disability benefits for 24 months, which is 2 years. 2 years ever be ended buying ever send a red, white, and blue card, regardless if you are 65 or you are under 65. And now, so no, Lou Gehrig's disease, the month that social security benefits, ever shares, buying automatically, or the card, ever bro. So if you don't fall in all these 3 categories, I will say, signing up for Medicare Part A and or Part B. So if you are getting close to 65 years, but won't receive social security benefits, which is most of the time, the majority of us, we're not receiving social security benefits. Yenye Juma Emma Railroad Retirement Board. And there are 3 months. Aka 3 months. Mumienshe ahanon sopa. Aka 3 months and sana where the 65 no. Either so obeko social security office aqua apply for Medicare. And now say obeko online ssa.gov/Medicare. Now wako sign it up. Abino will not send you a card automatically. Enroll automatically. You will have to sign up for these benefits. So once sign it up, they give you 3 months before you turn 65. And then 3 months after you turn 65. If you don't sign up, now almost a 7-month period, which is the 3 months before your birthday month, and at the 3 months after your birthday month, and that's a period of 7 months. So almost 7 months, HM. Now, when you sign up for Part A and Part B, you will end up paying penalty. And no, I am who be brave. Yang Ghana Fomone, yang immigrants are ever chrome has said no. We don't sign up for the benefits on time. They only give you a 7-month period, 3 months before your 65th birthday, 3 months after your 65th birthday. No one signing up to avoid penalty. Because the longer you wait after your initial enrollment period, which is the 7 month, so wuchemu afibia wa enrollee biano, there's an additional 10% penalty albichia. It's most of the time, by the time I yenimbra yahosono, now we are paying more than we're supposed to pay if we had enrolled before. It's a moma share of no ensu. So Part A, Part B enrollment period, any. Number 1, there are 3 periods that ubitmi enrolling. Number 1, your initial enrollment. Initial enrollment, na meka say 3 months before you turn 65 and 3 months after you turn 65, you have to enroll. So say, by the time I was 65, Juma, you are actively working. And it's Uji insurance from the Juma Mua. This is what you need to do. Because it's a Part A, free if you have worked in the US and paid Medicare taxes for 10 years. Because Part A no free amount into no. When your initial enrollment number 3 months before your birthday, 3 months after your birthday now, go ahead and sign up for the Part A, so you can get that for free because it's free. And train and kasa me juma me insurance benefits from a juma muntino may chain Part A until the year. Or chain you will end up having to pay because time I was somewhere enrolling one enrollee. But the Part B, because Part B, you have to pay premium. It doesn't matter, say, why you're Juma 30 years, I pay Medicare taxes for 30 years. You still have to pay Part B, To say, at the age of 65, Juma, now would you insurance from your company? You can postpone Part B, because Part B requires you to pay premium, You bet me up postpone it because you said already or insurance coverage from Wajumemu. To postpone you are okay. They will not give you any penalty because you have other insurance from Wajumemu ebeboa. But say at the age of 65, now you find say why retire. We need insurance, and I say ukunu and our spouse or any insurance at Odaso. Make sure say at the time of your initial enrollment, which is the 3 months before your birthday, 3 months after your birthday, over signing up for both Part A and Part B. Another enrollment period, any friend is special enrollment period, Special enrollment period, usually a comma or more at the age of 65. Now, work a juma, insurance benefits from a juma. Like I said, you still need to go ahead and apply for the Part A because A is free. As long as it's a wire juma, 10 years will you as extra Medicare taxes in the day, A free for you. So you get it regardless of say, juma, insurance from a juma or not. But Part B, so postpone anytime will be able to decide to say, retire from a juma. And I say anytime will be a say a juma so be you were due. Anytime you will lose that insurance now, you have a window of time. You go back to Medicare and say, hey, now I need Medicare Part B. And they will enroll you through this special enrollment without any penalty. And then there's also what we call a general enrollment. General enrollment, usually, a year from January to March. January to March, which is a general enrollment. Wow, we delay now I enroll it during your initial enrollment. We need any special reason to be then first already fee so be enroll it. This is the time I enroll it again. But most of the time, if you missed your initial enrollment now, 3 months before your birthday, 3 months after your birthday now, OKYERE general enrollment now, keep in mind, say, you will end up having to pay penalties. Okay, I think I have gone through all of this. Okay, I've talked about that. So we'll go over Medicare Part D. Medicare Part D, like I said, ekova wundro. There are 2 ways that ubitsi 2 ways you say. If you go with the original Medicare, which is Part A and Part B, which is by the government entity, and you will need to have a drug coverage. You will need to have Part D. Part D, again, covers all your medicine. What I have noticed with us immigrants, and then they say, a good time you qualify for Medicare, say, as long as we have the red, white, and blue card, it should cover everything. No, it doesn't work like that. The red, white, and blue card, cover your medical expenses. But when it comes to Undra, you still need to have insurance for Undra. And you can go on the marketplace, you can go on Medicare and sign up for Medicare drug coverage. And also, so you will end up paying premium there. You will end up paying deductible. All the terminologies we talked about, no, you will end up paying that. But most of the time, no, there is income-based payments. Depending on the income, no, me reduce or premium. Some people get $0 premium, which means that so depending on or income, no, and the better sika ubetia every month amano. Now 2 years, let's say 2 or 3 years back, now Medicare Part D, there was a problem with it, especially when it comes to out-of-pocket costs for people. Because at the age of 65, now a lot of people are on restricted income. Now people were finding it very hard to afford their medicine. They have something called the gap. When you get into the gap, wardrobe insurance no enkoba until say you will come out of the gap and then they will start covering again. It was complicated. So Medicare sat down last year, 2025. And then say, okay, this is what we are going to do, because people ended up having to be in the hospital. They could not afford their medicine because the drone was too expensive for them. And see, the year 2025, moving forward, they came up with a plan. They have minimized the out-of-pocket costs for people on Medicare Part D. And if I remember correctly, don't quote me on this, I believe we said the out-of-pocket cost, it's roughly about $2,400, which is $2,400. And he said, oh, Medicare Part D, now your out-of-pocket cost, it reaches $2,400 now. It becomes $0. So now people are picking up their medicines. Omuntimi ento medro You find they say, oh, some expensive blood thinner be to say Xarelto or all of those new medications now not expensive. Medicare brought something Medicare payment plan. See, if you cannot afford your medicine, there is a plan that you will volunteer say you want to be part of the plan. So you call your Medicare, your Part D Medicare now sign it up for or for what or say you want to voluntarily sign up for the payment plan. Or sign it up for it. You just mentioned to them, say you are part of the payment plan. So where $500 a crown by law it was said sell it to you for $0. I have to sell it to you for $0, and then Medicare ever send bill bosome bia na watua ne kakra instead of senka $500 no ka me over pharmacy honoma na ma charge say tua $500 now I'm not able to do that. As long as I say over sign it up for the payment plan over say $1,000 a crown, I have to sell it to you for $0, and then you pay Medicare. Now the catch in say so Medicare S&O bill now when you may end up losing your insurance. And also a idea it was say we'll keep it in mind. So OKYERE now the two payment plan is what. Just make sure say the way my break it down payments ubechia senebeya enko affected or Medicare Part D as a whole. Now Medicare Part D also we have initial enrollment, and then we have an open enrollment. Initial enrollment, again, is when you become eligible for Medicare, or 3 months before your birthday, or 3 months after your birthday, and a year will initial enrollment for the Part D. Now, so when me are enrolling for Part D, I feel between October 15th and December 7th, there's an open enrollment for Part D. And so what Part D need that this is the chance that me as a plan. This is the chance that me I could choose other plans, or so one sign it up me I could sign it up for Part D without paying any penalty. Yeah. This one is not necessary. I talked about the prescription payment plan. I think the member Payama Yebusa questions na Emre Kakra Moa. I would like to suggest something na ebetimi aboa as immigrants, as empenyufo a yɛkɔ retirement age no. Send a bear ebetimi care and I say ebetimi take care of ye mpanyimfi so sika yebetua for your care. Nti I will open the room up for questions and also contributions in the and as a member Mohammed they cannot was so.
Doctor, yeda sibebre wo adesua wo de amaye. Na me question is say this year the one the okay before about 2 minutes ago say enrollment no payment plan no.
Gotcha.
I say your payment yepsa payment plan no. And say call pharmacy na watua usika no. Enye the same thing and I say payment plan no de upe bia na ubetua yes our payment plan na de upe bia na ubetua and I say the same amount and ka call pharmacy and ka betua no. Eno na ubetua na say omo stretch you payment no sebe ya wuntua no anytime bia ubetua no. Minim say what's the mpese me che yes.
And it's a very good question. So the payment plan, no, it's on the co-pay of the medicine. So insurance, no, you can say obeji a pharmacy. Na a draw no senka uchia out of pocket $100. So me believe your insurance, and because of the agreements they have with the government and then the manufacturer of the medicine, no. It's like I say, instead of say $100 of the cash price of the medicine, no, I was me charge of $20 a pay. But you will follow.
Aye, Patra.
So that $20, no, and as a Oba pharmacy owner won't me afford that $20 now. That's a payment planner. We put that $20 no on payment plan. It won't be the $100, the cash price of the medicine, no. But what I say, but what I say, the amount near the better payment plan is no. It's your co-pay. It's what you will pay after we bill your insurance, no. And no, and now we decided say you want to pay that amount up front. If you can't afford it up front, then we will put it on a payment plan for you.
Okay, thank you.
Mr. Medas.
You, Doctor, that's my first question is that if you are already on these plans, a Part A and Part B in Nigeria, with a specific provider, do you need to renew it yearly? And the second question is in there. With the current debate about the expiry of them Obamacare agent, how is it going to affect Medicare if it's left to expire?
Okay, thank you. Pacho, if I understand that clearly, first question, no, yes, already no, Part A, Part B, and then the Part D. Do you have to renew it every year? My answer is yes. Every year, Biano, you will need to renew it. The reason being is yenipano, as far as our healthcare is concerned. It's a drobia nanka wonda so before no. Now no doctor ediaka o regimen home. And now say some services bia now you don't need it, no, now no, you need it. It's a phibia when the opportunity comes to say, oh, it was set with me as a son now. Don't sit there. Go and there are some portals that you can put in all the services that you require. all the drugs that you're taking. Now, what's me I compare the providers na ɛwɔ hɔ no nyinaa, so you can pick and choose which one which one is cost effective, which deductible which out of pocket cost meet with your needs. And when the opportunity comes, at least go and look. It doesn't compare to what you already have. You can keep what you have, but it's always better to go out there and look to see, say, if there's something a bit more coverage at a lesser cost. If that makes sense. And now,
very much.
Okay. And our second question was about Obamacare no more say do away with it and how it will affect Medicare. As a matter of fact, the impact me have on Medicare, but I do know, say, as far as private insurances are concerned, Obamacare was able to leverage some of the costs for people that nka omuntimi afford it, and I say people nka omuni ejuma ebetimi abo to offset some of the cost of these premiums with the private insurances. And doing away with the Obamacare, I can foresee prices of insurance being high if you're not going through a company. It may be high, just like before Obamacare existed. Insurances was very high, high premiums for people that talk by themselves and do away with getting insurance through Omo company and Bisa. So, as far as the impact it will have on Medicare, dear, honestly, I have not looked into it, but as private insurances, dear, it will have a huge impact on the premiums.
Another issue is sometimes doctors do one more prescription one more some rebate cards yes, and all those things now, and so that sort of practice, and is it standardized now? Or your special doctors and what the mom?
Okay, very good question. Most of the time, those drug cards, are for drugs are about marketing, so very new. Most of the time, drugs it doesn't even have a generic yet. About marketing, so maybe 3 or 4 years ago, it hasn't come to the point where other manufacturers are able to copy the drug and make generics from it. There's no generic drug, Dr. Bitmiamau, a manufacturer keep on Sefako pharmacy now on so amount. You may find some discount cards, say it was a good RS card, family wise card. Sometimes they mail some to you to take to the pharmacy. But those cards, it's not a card that we can bill in addition to all primary insurance that you have. It's either we bill your primary insurance or we bill the card by itself. But with the ones our doctors need them out, for drugs are new on the market, like Januvia, Farxiga. Some of them are me Ekai so far, QVAR. It's new medications about markets and so, and then the manufacturer to help offset some of the costs and to also make sure say doctors are prescribing their medicines to patients and they offer these cards to bring the cost down be affordable to the patient. But most drugs don't have that.
Pacho, no. Ellen, Pacho mute why? Ellen, thank you.
Opinion Pacho, I hope I have answered your question.
Amen. Right.
Yeah. Doctor Pacho, my question ewo ho biom say wo ebi ana maame panyimu bi ana papa panyimu bi a owo medical age wa or besra ne baby ana se wote krom ha but obi krata onye adwuma for 10 years or betumi qualify for anything. Yeah, ebetumi aboa say nipa sa. That's
okay, very good question. Say nipa sa no so oye or green card. Say oye ni stay or America no or green card and also oye citizen. They can still sign up for all of these benefits. They can still get Part A, they can get Part B, they can sign up for Part D. But premium free, which is Part A, omo enye free ma omo. You can sign up and you can pay if you can afford the premiums of all of these. As long as I say, oh yeah, a permanent resident. Let me use that word. If you're a permanent resident, and yes, it be a waba for stay keke, and now say, oba for visits nawako. No, you have to be a permanent resident, and to qualify, again, you have to be 65 years. So, Part A, is free to you. Like you don't pay any premium, you don't pay any monthly cost on that Part A now. Then the requirements, and they say you have to work and pay Medicare taxes for 10 years. And if they have not, they can still sign up for it, but they will pay premium. I hope that makes sense. And yeah, mame for ni, papa for na, yeah, Juma. Be a ba krom ha no ye adwuma under people yentria Medicare taxes sometimes we risk getting these benefits because abemo it's not showing say you contribute to any Medicare taxes and say be an nipa no ba krom ha no we more than 10 years but onye adwuma I contribute to I show say why adwuma for like we contributed to Medicare taxes for 10 years and see when they sign up, they will have to pay premium for it.
okay. Thank you.
Yeah, doctor, you for those prescribed people, these are all kind about them visitors now doing painful. I don't know if you know about them health centers, especially women health centers, who provide services to cover those situations. I don't know if you know about them. Now, what you can tell us about.
I do. Every county, well, meaning about the state of New York, but where I live, every county has a health department. Health departments in Oka, there's no question asked. That was so almost show. If there are some facilities like normally, Ayana, the city and also the state, health departments, there are some days that maybe they walk me area. There are some days that treating men and there are some days that are dedicated for women in kwa. Some days are for children. Some days for nutrition. So they have different days that me to receive care. It is a beer will be about a straw. This past summer we had some people that came from Ghana. Normal call general conference maybe. But none of home. That's where I took him. He went to health departments. They took very good care of him. No questions asked. He didn't have insurance. Obian sendi Obia bill. So these are some of the things that are available to us at me a use. Even if we say be a insurance now you feel like say you need extra care. Sometimes it be a called urgent care, but you don't want to go and pay amount of money be our urgent care one. Not say a day they are open to receive you and take care of you. But go there, they will give you free healthcare. And that's a be things like dentistry or senior. Most of the time, if you look at universities like dentist school or area, they are always looking for people to use and have their students or graduates, to practice some of the things that on. And I'm telling you, most of the time the students do better job than people are ever field anymore already because they are more careful. And see, these are some things that over to me as I say, especially eye doctors. You can go to universities that the friends say optometry school or area honoma. They are always looking for people to test on and practice on. So you can do that and receive free healthcare.
And further to that, under the current political atmosphere, what's happening to these centers now? Are they still operational? And
they are still in operation. I think that they cannot completely do away from it. They may say yeah, more enough funds to operate, but I don't think that they will be able to completely get rid of it because the states, there are still going to be people that will be dependent on the states and dependent on the government. And they still need to go somewhere. Yes, and also be an additional burden to the government. I think that they will still be there. They'll be there. They may have limited services though, but they will be there.
that's about.
Patrick, any additional question, Bia?
Yo, doctor, a person make a saka crowd. You did kind as a pa ni churchra or churchra ne day. Yes, soon the pa Yankupon to need the moment. The question I make person be son, sir. Say, we permanent resident. Now that it be at say we insurance swap. I say, once when you do my year, name no, won't mean not 10 years, no. I be a walk retirement. What means sign on A, B, and D? No, we redeem one. The question.
Okay. All right. Very good question. Very good question. Medicare, number one, Medicare no means sign up under your spouse. You cannot sign up or spouse ain't me and cover. But here's the catch. Say or spouse aye juma for you have to say no, you have not been able to contribute to Medicare taxes for 10 years but say was spouse aye juma I contribute to for 10 years now. You can receive that benefit because Ekroma they recognize both of you as one unit.
Wonderful.
You can receive that benefit, and then sign up for the Medicare once you're about to turn 65, or 3 months before and you're 3 months after your 65th birthday, you can sign up and receive that benefit, because say your spouse, Juma, contributed to Medicare taxes for that 10 years, it's a mabibro honoma, they are stay at home moms. If you are on Juma that time period to contribute. So these are some of the ways that omutimi cover some of the spouses now omutimi and contribute here, but it would depend on how long waba kroma. So oba say be a permanent residence, if I say a year 5 years ago, you're about to turn 65 this next year 2026 or wife for dear it would not be possible to cover you because you've only been here for 5 years. And so as long as I say owner was 5, so no, Matina Krumha, almost friend, almost say the word in the document here 40 quarters, 40 unsahano with a jumano, quarters near Kano. To say why a juma 40, it doesn't have to be 10 years consecutively. If I say juma kakra, but if all of them together, if it amounts to 40 quarters, which all stretch consecutively by 10 years, you will qualify. You qualify for the premium free because your wife or your spouse contributed for that 40 quarters.
Wow.
I hope that makes sense. It's kind of complicated. Okay. All right. Thank you. But so I know I only have 1 minute. I really want before, and I say, yeah, immigrants for no, I want us to really benefit. So now that close to 65 yet. We're not close to 65. But these are some of the ways. I'm about to share one thing a bit me aboa right now. We juma. A bit me aboa ama what's me a save enough sika to care for yourself when you hit that 65 and retirement age, So in the 65, from now till the month before you turn 65, if you qualify for something called Health Savings Account, which is HSA account, make sure say you are contributing to your HSA account. So Ubetsimia, contribute the maximum you can contribute every year. I think say this year, give me 1 second. I mean pull HSA contribution. I want to give the exact figure now. Okay. So for the year 2026, the maximum contribution I'll be contributed towards your HSA account. So you're singular. Now you're less than 55 years of age. But you know this. If you are less than 55 years of age, now you're singular. You can contribute a maximum of $4,400. Some way family, you can contribute a maximum of $8,750 for a family. So when you're individual, nase, when you're age 55 and older, you can contribute an additional $1,000 to it. And now say, when you're 55 and older as a family, you can contribute up to $9,750. So if you are less than 55, now you're singular, $4,400 tax-free. Okay, you contributed tax-free. Your family $8,750 tax-free. Okay, into the HSA account. Now, when you contribute into the HSA account now, so we see no contribution once it hits 2,400. Tamu kwenti meeting the exact, but between 2,400 and 2,800, which is 2004 to 2008 now, that health savings account, it becomes an investment account. Okay, it becomes an investment account. I'll use my family as an example. We contribute towards a manager Fidelity. Okay, Fidelity and a manager HSA account, but through a bank called Optum. Once you contribute to that amount, it becomes an investment account where they use some of the money to buy stocks, and so the money starts accruing interest. Interest never attend them. So if you are able to contribute every year as a family, over $8,700 into that account, what this account does is say, anytime you sign up for insurance or premium, you can use it to pay your premium. You can use it to pay your deductible. Or call pharmacy, over the counter, Tylenol, Vaseline, Q-tip, anything that is medical related. Say, we hear a friend say, sometimes anymore, we may require some a friend say pull-ups, diapers, inside all of those equipments. These things will cover, and the good thing is a tax-free. That money, if you contribute directly from your checker, no tax is taken out, tax-free. And it will grow. And to say, what's me contribute to this amount until even half of it, until we do the age of the month before you turn 65, any time na sika woman, any health problem will be facing, you may have enough money to tackle it. In addition to Medicare Part A, Part B, and Part D that you have signed up for. No, let's now wait until say you're 65, and sana you start to say gather sika and trying to figure out what we need to do to take care of our health. Now, no, HSA account is there. Health savings account, you can contribute. But don't confuse health savings accounts, with flexible savings accounts. Flexible, no FSA card, no, whatever you contribute on, no. December 31st, if I say, contribute 8,000 crowd on there, December 31st. So when you should say 8,000 now, sika kasubi ana shegu. But HSA card, no, who contribute to whatever akasubiano, it keeps rolling over, afibia, a rolling over, so you don't lose money. If you have FSA account, it's very good, it's equally good. But the thing is that it doesn't become an investment account and it doesn't roll over every year. See, December 31st, and that's when you shoot every penny you have saved on that card now, you lose it. See, Mama Yankee put that in mind. Now, you may have the opportunity, bounce as well. Nasa mu invite me. There are other things you bet me I can want them in order to help us get to make better choices.
Amen.
Okay, that was a addition of the I hope say I a bad line soon so addition yes you the juma ama abuaye in our healthcare journey. Yankopon share say ba and questions and contributions are a buying so yeda nina say.
Pray anytime. Pray when you're sad. Pray when you're glad. Pray when you're weak. Pray when you're strong. Just pray and pray. 'Cause anytime is prayer time. Pray, pray, pray anytime. Pray when you're sad. Pray when you're glad. Pray when you're weak. Pray when you're strong. Just pray and pray. 'Cause anytime is prayer time. Ooh. The offices in heaven, they're opened up for you every second.